Concerns over the Delta variant haven't waned, and it now makes up more than half of coronavirus cases here in the U.S. I think this is a good time to bring in our Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. Dr. Adams, do you expect a surge after the July 4th weekend since so many people were out and about?
Well, it's a great question, and we won't know for a few weeks for certain, but we know that anytime people come together, especially if they're unvaccinated, that increases the risk for the spread of coronavirus, particularly with this new, more transmissible Delta variant, which, as you mentioned, accounts for over 50% of cases. So what people need to know is that if you're having symptoms of COVID and you were unvaccinated after a gathering this weekend, please go in and get tested as soon as possible, because that can help us prevent spread of the disease. It can also help you get connected with treatment sooner so that you hopefully don't end up in the hospital.
You and I have talked about this, that it's our responsibility to know what's going on in other places. What do you make of the news out of Israel saying that the Pfizer vaccine is only 65% effective against the Delta variant?
Well, so glad you asked me that question. It's important to know that when we evaluate these vaccines, we look at number one, whether or not it prevents hospitalization and severe illness, and number two, whether or not it prevents spread of infection. That 65% number you're hearing about from Israel is 65% effective at preventing spread of infection based on data that they've gathered there. But it's still over 90% effective at preventing hospitalization and severe illness. I want everyone to know that your best protection against COVID remains to get a vaccination. And that's even, and this is breaking news from Scott Gottlieb, a friend of mine, former FDA commissioner, that even the new Lambda variant that we're hearing about looks like it's sensitive to vaccines in terms of preventing severe illness, hospitalization, and death.
So what about people who got the Johnson & Johnson vaccine?
Well, I've been getting a lot of questions from folks who've gotten the J&J, and you've gotten some good news recently. Just last week, there were new studies that came out that showed that the J&J vaccine provided durable protection 8 months after the first dose, so no need for a booster yet, and that it was effective against the Delta variant, again, particularly in preventing hospitalization and severe disease. So stay tuned, but people who got the J&J vaccine, and that's 11 million people in the U.S., know right now that things are still looking pretty good for you.
There's some folks that think that things are kind of, weaning down, but there's still a big push from the White House and governors to get more people vaccinated. What do you say to those who are still very hesitant?
Well, I would say, number one, I understand where hesitancy comes from, and I try not to shame people at all. I want you to ask questions. Talk to your healthcare provider, talk to your doctor, to your nurse practitioner, to your pharmacist. Get your questions answered. It's okay to have questions. What's not okay is to let misinformation lead you into a bad decision. And if you're like me, you've got young kids going back to school, you want them to be able to stay in school this school year. So if they're eligible to be vaccinated, get them vaccinated like I did my 15 and 17-year-old. If you're eligible, then you can help protect your children. I have an 11-year-old daughter who's not eligible for the vaccination, but we protect her because we're vaccinated around her. Give them the best shot at a great school year, and give yourself the best shot against these new Delta and Lambda variants by getting your questions answered and then hopefully choosing to get vaccinated.
Dr. Adams, thank you so much. I know you have a lot of work to get to today. We appreciate you. I think this is a good time to, thank you so much. I think this is a good time to go back to that breaking news that we first brought you. I think we have Demi Johnson here.